Q1. The nurse is teaching the client with polycythemia vera about prevention of complications of the disease. Which of the following statements by the client indicates a need for further teaching? I will drink 500 milliliters of fluid or less each day. I will wear support hose. I will check my blood pressure regularly. I will report ankle edema. Q2. The client is instructed regarding foods that are low in fat and cholesterol. Which diet selection is lowest in saturated fats? Macaroni and cheese. Shrimp with rice. Turkey breast. Spaghetti with meat sauce. Q3. 500 mg of amoxicillin is prescribed to a patient 3 times a day. 250 mg tablets are available. How many tablets for single dose? 4, 2, 6, 1.5. Q4. Clients with sickle cell anemia are taught to avoid activities that cause hypoxia and hypoxemia. Which of the following activities would the nurse recommend? A family vacation in the Rocky Mountains. Chaperoning the local boys' club on a snow skiing trip. Traveling by airplane for business trips. A bus trip to the Museum of Natural History. Q5. The 6-month-old client with a ventral septal defect is receiving Digitalis for regulation of his heart rate. Which finding should be reported to the doctor? Blood pressure of 126/80. Blood glucose of 110 mg per deciliter. Heart rate of 60 bpm. Respiratory rate of 30 per minute. Q6. The nurse is instructing a client with iron deficiency anemia. Which of the following meal plans would the nurse expect the client to select? Roast beef, gelatin salad, green beans, and peach pie. Chicken salad sandwich, coleslaw, French fries, ice cream. Egg salad on wheat bread, carrot sticks, lettuce salad, raisin pie. Pork chop, creamed potatoes, corn, and coconut cake. Q7. The nurse is checking the client's central venous pressure. The nurse should place the zero of the manometer at the phlebostatic axis. PMI. UBS point. Tail of Spence. Q8. A 43-year-old African-American male is admitted with sickle cell anemia. The nurse plans to assess circulation in the lower extremities every 2 hours. Which of the following outcome criteria would the nurse use? Body temperature of 99 degrees Fahrenheit or less. Toes moved in active range of motion. Sensation reported when soles of feet are touched. Capillary refill of 3 seconds. Q9. A 21-year-old male with Hodgkin's lymphoma is a senior at the local university. He is engaged to be married and is to begin a new job upon graduation. Which of the following diagnoses would be a priority for this client? Sexual dysfunction related to radiation therapy. Anticipatory grieving related to terminal illness. Tissue integrity related to prolonged bed rest. Fatigue related to chemotherapy. Q10. The client with a history of diabetes insipidus is admitted with polyuria, polydipsia, and mental confusion. The priority intervention for this client is measure the urinary output. Check the vital signs. Encourage increased fluid intake. Weigh the client. Q11. A client has autoimmune thrombocytopenic purpura. To determine the client's response to treatment, the nurse would monitor platelet count, white blood cell count, potassium levels, partial prothrombin time, PTT. Q12. Patient states, "I hate cancer." According to Kobler theory, this is anger, denial, acceptance, bargaining. Q13. Registered eye and roll while administering medicine. Should know about all medications. Should know about medicines, explain to PT to make them understand why they are taking them. Forgiving for medicines, get help of other nurse. Q14. The home health nurse is visiting a client with autoimmune thrombocytopenic purpura, ATP. The client's platelet count currently is 80,000. It will be most important to teach the client and family about bleeding precautions, prevention of falls, oxygen therapy, conservation of energy. Q15. The client is admitted to the hospital with hypertensive crises. Diazoxide, hypostat, is ordered. During administration, the nurse should utilize an infusion pump. Check the blood glucose level. Place the client in Trendelenburg position. Cover the solution with foil. Q16. Which check do you need to carry out before setting up an enteral feed via nasogastric tube? That when flushed with red juice, the red juice can be seen when the tube is aspirated. That air cannot be heard rushing into the lungs by doing the whoosh test. That the pH of gastric aspirate is below 5.5 and the measurements on the NG tube is the same length as the time insertion. That the pH of gastric aspirate is above 6.6 and the measurements on the NG tube is the same length as the time in. Q17. While mentoring a final year student dispensing medication. Nurse role. Direct supervision. Before delegating, find out he is competent. Ask him to tell after the administration is complete. Q18. The nurse is conducting a physical assessment on a client with anemia. Which of the following clinical manifestations would be most indicative of the anemia? BP 146/88. Respirations 28 shallow. Weight gain of 10 pounds in 6 months. Pink complexion. Q19. A 32-year-old mother of 3 is brought to the clinic. Her pulse is 52, there is a weight gain of 30 pounds in 4 months, and the client is wearing 2 sweaters. The client is diagnosed with hypothyroidism. Which of the following nursing diagnoses is of highest priority? Impaired physical mobility related to decreased endurance. Hypothermia RT, decreased metabolic rate. Disturbed thought processes RT, interstitial edema. Decreased cardiac output RT, bradycardia. Q20. A client has had a unilateral adrenalectomy to remove a tumor. The most important measurement in the immediate post-operative period for the nurse to take is the blood pressure, the temperature, the urinary output, the specific gravity of the urine. Q21. 25-year-old girl with learning disabilities is admitted for a minor surgery. She is very restless and agitated and wants her mother to stay with her. What will be your response? Advise the mother to stay till she settles. Tell her visiting hour is over. Tell her you will take care of the child. Q22. A 25-year-old male is admitted in sickle cell crisis. Which of the following interventions would be of highest priority for this client? Taking hourly blood pressures with mechanical cuff. encouraging fluid intake of at least 200 milliliters per hour. Position in high Fowlers with knee get raised. Administering Tylenol as ordered.
Please don't forget like and subscribe. Thank you.
Q23. After completion of nursing notes, nurse should sign, printed name, designation, time, date. Sign, designation, time, date. Sign, time, date of birth. Q24. The client is being evaluated for possible acute leukemia. Which inquiry by the nurse is most important? Have you noticed a change in sleeping habits recently? Have you had a respiratory infection in the last 6 months? Have you lost weight recently? Have you noticed changes in your alertness? Q25. What are the principles of communicating with a patient with delirium? Use short statements, closed questions in a well-lit, quiet, familiar environment. Use short statements, open questions in a well-lit, quiet, familiar environment. Write down all questions for the patient to refer back to. Communicate only through the family using short statements, closed questions. Q26. A patient needs weighing, as he is due a drug that is calculated on body weight. He experiences a lot of pain on movement, so is reluctant to move, particularly stand up. What would you do? Document clearly in the patient's notes that a weight cannot be obtained. Offer the patient pain relief and either use bed scales or a hoist with scales built in. Discuss the case with your colleagues and agree to guess his body weight until he agrees to stand and use the chair scales. Omit the drugs as it is not safe to give it without this information. Inform the doctor and document your actions. Q27. Where is the best site for examining for the presence of petechiae in an African American client? The abdomen. The thorax. The earlobes. The soles of the feet. Q28. What steps would you take if you had sustained a needle stick injury? Ask for advice from the emergency department. Report to occupational health. Fill in an incident form. Gently make the wound bleed. Place under running water. Wash thoroughly with soap water. Complete an incident form. Inform your manager. Cooperate with any action to test yourself or the patient for infection with a blood-borne virus, but do not obtain blood or consent for testing from the patient yourself. This should be done by someone not involved in the incident. Take blood from patient self for Hep B screening. Take samples form to bacteriology. Call your union representative for support. Make an appointment with your GP for a sickness certificate to take time off until the wound site has healed so you contaminate any other patients. Wash the wound with soap water. Cover any wound with a waterproof dressing to prevent entry of any other foreign material. Wear gloves while working until the wound has healed to prevent contaminating any other patients. Take any steps to have the patient or yourself tested for the presence of a blood-borne virus. Q29. A 30-year-old male from Haiti is brought to the emergency department in sickle cell crisis. What is the best position for this client? Side lying with knees flexed. Knee chest. High Fowlers with knees flexed. Semi-Fowlers with legs extended on the bed. Q30. The client is admitted with left-sided congestive heart failure. In assessing the client for edema, the nurse should check the feet, neck, hands, sacrum. Q31. The body part that would most likely display jaundice in the dark-skinned individual is the conjunctiva of the eye, soles of the feet, roof of the mouth, shins. Q32. A client with hemophilia has a nosebleed. Which nursing action is most appropriate to control the bleeding? Place the client in a sitting position. Administer acetaminophen, Tylenol. Pinch the soft lower part of the nose. Apply ice packs to the forehead. Q33. A newly admitted client has sickle cell crisis. He is complaining of pain in his feet and hands. The nurse's assessment findings include a pulse oximetry of 92. Assuming that all the following interventions are ordered, which should be done first? Adjust the room temperature. Give a bolus of 4 fluids. Start O2. Administer meperidine, Demerol, 75 mg for push. Q34. The client has surgery for removal of a prolactinoma. Which of the following interventions would be appropriate for this client? Place the client in Trendelenburg position for postural drainage. Encourage coughing and deep breathing every 2 hours. Elevate the head of the bed 30 degrees. Encourage the Valsalva maneuver for bowel movements. Q35. The client presents to the clinic with a serum cholesterol of 275 mg per deciliter and is placed on rosuvastatin, Cresta. Which instruction should be given to the client taking rosuvastatin, Cresta? Report muscle weakness to the physician. Allow 6 months for the drug to take effect. Take the medication with fruit juice. Report difficulty sleeping. Q36. A client had a total thyroidectomy yesterday. The client is complaining of tingling around the mouth and in the fingers and toes. What would the nurse's next action be? Obtain a crash cart. Check the calcium level. Assess the dressing for drainage. Assess the blood pressure for hypertension. Q37. You are assisting a doctor who is trying to assess and collect information from a child who does not seem to understand all that the doctor is telling and is restless. What will be your best response? Stay quiet and remain with the doctor. Interrupt the doctor and ask the child the questions. Remain with the doctor and try to gain the confidence of the child and politely assess the child's level of understanding and help the doctor with the information he is looking for. Make the child quiet. Ask his mother to stay with him. Q38. Nurse and colleague found a discrepancy of controlled drug. How to report? Inform police. Inform pharmacy. Recheck, inform in charge, if not found inform senior nurse. Q39. You noticed medical equipment not working while you joined a new team and the team members are not using it. Your role? During audit, raise your concern. Inform in written to management. Inform NMC. Take photograph. Q40. Hemorrhoids risk factor. Straining of stools. Veg diet. Fiber-rich food. Non-processed food. Q41. Which of the following would be the priority nursing diagnosis for the adult client with acute leukemia? Oral mucous membrane, altered related to chemotherapy. Risk for injury related to thrombocytopenia. Fatigue related to the disease process. Interrupted family processes related to life-threatening illness of a family member. Q42. What are the most common types of medication error? Nurses being interrupted when completing their drug rounds, different drugs being packaged similarly and stored in the same place and calculation errors. Unsafe handling and poor aseptic technique. Doctors not prescribing correctly and poor communication with the multidisciplinary team. Administration of the wrong drug, in the wrong amount to the wrong patient, via the wrong route. Q43. The nurse is conducting an admission assessment of a client with vitamin B12 deficiency. Which finding reinforces the diagnosis of B12 deficiency? Enlarged spleen. Elevated blood pressure. Bradycardia. Beefy tongue. Q44. Which of the following foods would the nurse encourage the client in sickle cell crisis to eat? Steak. Cottage cheese. Popsicle. Lima beans. Q45. When will you disclose the identity of a patient under your care? Justified by public interest, law and order. When media demands for it. When patient relatives wishes to. You can disclose it anytime you want. Q46. A client with Addison's disease has been admitted with a history of nausea and vomiting for the past 3 days. The client is receiving full glucocorticoids, Solu, Medrol. Which of the following interventions would the nurse implement? Glucometer readings as ordered. Intake-output measurements. Evaluating the sodium and potassium levels. Daily weights.
Please don't forget like and subscribe. Thank you.
Q47. In a canteen QPT collapses in front of you, what will be your response? Run to bring AED. Shout for help. Asses for response. Asses for danger before approaching. Q48. A 33-year-old male is being evaluated for possible acute leukemia. Which of the following findings is most likely related to the diagnosis of leukemia? The client collects stamps as a hobby. The client recently lost his job as a postal worker. The client had radiation for treatment of Hodgkin's disease as a teenager. The client's brother had leukemia as a child. Q49. The client admitted with angina is given a prescription for nitroglycerin. The client should be instructed to replenish his supply every 3 months. Take one every 15 minutes if pain occurs. Leave the medication in the brown bottle. Crush the medication and take with water.